Good morning. As most of you know, I am Nancy Velasquez. I am the Community Health Manager here in Omaha, Nebraska. Sitting next to me is Maria Dowdeth. She is our nurse practitioner, family nurse practitioner here at Fred Leroy Health and Wellness. We're just going to give it about a minute so others can join us before we dive into Maria's presentation this morning. I hope everybody is doing well. At least we're getting a break from the rain. Also, I would like to remind you that any questions that you ask, please keep them in general as we don't violate HIPAA. All questions will be answered at the end of Maria's presentation. Maria says we'll attempt to answer it. If we can't find the answer, or Maria doesn't have the answer for you right now, we'll get it to you afterwards. Okay, I see we have a lot of people on. Before we start with Maria's presentation, as some of you know who have came to our clinic, our nurse, Mark, yesterday, unexpectedly, we had found out that he had passed away. So we lost a member of our team here, and it's a little hard on everybody here at the clinic right now. But what I would like to do is I would like to take give a moment of silence for Mark. So if you could all please join me in a moment of silence. Thank you. Okay, so this morning, Maria is going to talk about our COVID-19 vaccine. As you know, there's 3 of them out right now: Pfizer, Moderna, and Johnson & Johnson. The one vaccine we've had here at the clinic is Moderna, but Maria is going to touch upon all 3. Please take note that we are not asking you to, we're hoping that it doesn't come across the wrong way and that we think everybody should be vaccinated. We're just giving you all the options that are out there in case you do want to be vaccinated. So, without further ado, I will give the floor to Maria.
Thank you, and thank you, Nancy. Thank you, everybody, for being here that took the time to listen today. And like Nancy said, my goal really here is just to provide some information regarding COVID-19 vaccination, and what you choose to do with that information is really a personal decision. But again, we're just all here and available for any questions that you may have about the vaccination itself. So, like Nancy said, there are 3 vaccinations here authorized in the United States by the FDA. The first one is Pfizer-BioNTech, and this vaccine came about, it was the first vaccine from the FDA to gain emergency usage approval on December 11th, 2020. It does have strict requirements requiring ultra cold temperature freeze, and so it has made distribution difficult. And then the status, like I said, it was granted emergency use in the U.S. and other countries. Initially, the trial enrolled 43,538 participants, and the trial is ongoing. 38,000 of those participants received the second vaccination. The vaccine's recommended for anyone 16 and older, and Pfizer BioNTech is still testing the vaccine in children ages 12 to 15. The dosage is 2 shots, 21 days apart, and common side effects related to this vaccination are really related to the immunization response and kind of the immune system mounting its response to fight the virus if the body was exposed. So chills, headache, pain, tiredness, redness and swelling at the injection site are all fairly common. Some of you may have heard about rare anaphylactic events that can occur. Just to give you some numbers, 11 cases and 18 million vaccinations did occur, which resulted in anaphylactic, which is a severe reaction that the body undergoes, requires kind of emergency response medication called epinephrine or EpiPen, and it's to recover, have the body recover from that response. And this is why the CDC and our health clinic requires that everyone getting the vaccine be monitored for at least 15 minutes. And if you've ever had a history of a reaction or severe allergies or are taking a blood thinner, we require 30 minutes. Just to tell you a little bit about how this vaccine works, it is a messenger RNA system. Messenger RNA kind of is like the blueprint for creating or manufacturing the body's defense mechanism. And in this case, the body's defense is to the spike protein of the coronavirus. And so the vaccine in a pocket, like a fat pocket, delivered into the system, it carries this blueprint or code that then the body's cells use to manufacture proteins, which in this case are antibodies to that spike protein. How well it works, 95% effective in preventing COVID-19 in those without prior infection. And how well it works on virus mutations, because we've heard about the Great Britain and the South African variants. The Pfizer BioNTech vaccine's been found to protect against the variant, the Great Britain variant, but is less effective against the variant first detected in South Africa. So now, as Nancy mentioned, we carry the Moderna vaccine, and that's the second vaccine to gain emergency use authorization in the U.S. This vaccine is also a messenger RNA vaccine. The unique thing about this is this vaccine can be shipped and kept in long-term storage in standard freezer temperatures, making the distribution much easier and more manageable, especially for smaller health clinics. Status emergency use, like I said, over 30,000 were initially enrolled in clinical trials, and this clinical trial intentionally included those individuals 65 and older and communities of color. So it was tested in a wider range of study participants. The dosage is 2 shots, 28 days apart, so about a month apart. And it also carries about the same side effects as the Pfizer vaccine, including chills, headache, pain, tiredness. Additionally, those rare occasions of anaphylactic reaction. And again, the CDC requires that patients receiving vaccination do be monitored for that 15 to 30 minutes after getting the vaccine. How well it works? Well, it's 94.1% effective at preventing symptomatic infection. How well the virus works on mutations? Some research suggests that the Moderna's vaccine may provide protection against both the Great Britain and the South African variants, the B.11.7 and the B.1.351. Researchers are still studying this, so this information is preliminary at this point. The third vaccine is the Johnson & Johnson. This gained emergency use approval by the FDA on February 27, 2021, so it is the most recent vaccine. This vaccination is for adults 18 and older, and Johnson & Johnson is starting to test the vaccine on children. This vaccine is uses a virus vector system, and the The thing about this system is it uses a carrier, and in this case it's the adenovirus, which is the common cold or bronchitis virus, to introduce the genetic code for the spike proteins to the cells. And this kind of works similar to like a Trojan horse, is kind of a good way to think of it. It sends a message inside of a harmless vector into the body to code for this the spike protein, the coronavirus spike protein, to the cells. The cells then use that to manufacture. So same idea, just a different delivery system. The shell and the code cannot make you sick, but once the code's inside the cells produce the spike protein, they send the message to all the other areas of immune response inside the body, the lymph nodes, the thymus, and then that trains the body's immune system to mount a response should you become exposed to the virus itself. How well it works? 72% overall efficacy, 86% against severe disease. And how well it works on virus mutations has been shown to offer some protection against the Great Britain. Hasn't really been shown to offer, or according to the analysis by the FDA, there was 64% overall efficacy and 82% efficacy against severe disease in the South African variant. So it does offer some protection there as well. Okay, so I wanted to provide a brief overview of the vaccines that were out there, and then I just wanted to talk to you about some common questions related to vaccination. So one of the I think biggest questions I get is that, or biggest concerns is that researchers rush the development of the COVID-19 vaccine, so its effectiveness and safety is of concern. And I did want to talk a little bit about this just to kind of explain some reasons or some events that occurred that allowed this to be more rapidly manufactured. Studies found that the two initial vaccines, like I mentioned, are about 95% effective, which is pretty good. The flu, 50 to 60%, so when 95% effective came out, it was like, wow, I felt pretty good about that. And then and like I said, the reasons that maybe allow for such quicker development and manufacturing of this is, first of all, the COVID-19 vaccines from Pfizer and BioNTech and Moderna, they were created using a method that's been in development for years. So messenger RNA, it's kind of been around for about 20 decades. I did do virology and immunology research before, and even then there was talk of using messenger RNA as the newest way to point specifically manufacture a vaccine. And so China also isolated and shared genetic information about COVID-19 promptly, so scientists could start working. So kind of remember back in January, they released the genetic code for the SARS coronavirus, and that was very helpful. The vaccine developers didn't skip any testing steps, but conducted some of the steps in an overlapping schedule. So, and one of the things that allowed this to occur was that governments gave them a lot of money to be able to develop and manufacture all in the same sense. They really didn't have much to lose, I guess, so to speak. And that was one of the reasons that they kind of just both developed and manufactured at the same time, which allowed, when the data came out, for the vaccines to be distributed. Social media helped companies find and engage study volunteers, and many were willing to help with COVID-19 vaccine research. So that helped us in the process too. The stakes were high, and some people kind of stepped in and were the first to try the vaccines out. Some types of COVID, and we talked about the messenger RNA. So one of the analogies that I kind of think about with this is the iPhone. When the iPhone first came out, and it was a lot of bells and whistles and a lot of troubleshooting was involved, but kind of as, now we're on like iPhone 10, 11, something like that, and they're able to make big strides with little time sometimes, and that's really what vaccine technology has done, and specifically messenger RNA in some ways. Question number 2, will the COVID vaccine give you COVID-19? Again, like mentioned before, it's really a blueprint or code. It's a protein that is a blueprint or code that tells your cells to manufacture the protein, which is in this case an antibody to the coronavirus that fights or neutralizes the virus if exposed. So it doesn't give the virus itself, it gives that code. And an analogy that I kind of think about is like the code that you send, a computer programmer sends into their computer that generates the picture on it. And you know, that's kind of really what we're doing with our bodies there. Another question is, does the COVID vaccine enter your cells and change your DNA? And again, the messenger RNA vaccines do not enter cells, or they do enter the cells, but they don't enter the nucleus where the DNA is housed. There's an area outside of the nucleus where the proteins are manufactured, and that's the area that this messenger RNA vaccine technology uses to manufacture the protein, which in this case is an antibody to the coronavirus. Is the messenger RNA technology used to make the COVID vaccine brand new? And again, we talked about this. It's really been around for about 2 decades. So another question that I wanted to kind of cover is the risk of the vaccine more significant than the risk of getting coronavirus? And I feel like this is a hard one to answer because there is some emotional involvement here, but I also feel like kind of maybe given the data, COVID-19's mortality rate is 1 to 2%. And that maybe doesn't sound initially like a lot, but that's 10 times more than the flu virus. So when we take into account those numbers, it does carry a significant mortality factor. And then also within the native population, those numbers have been disproportionately represented. And one of the statistics that I looked into was the Navajo Nation on March 7th, 2021 released their data, and it showed 1,201 people have died in less than a year within the Navajo Nation from COVID. They've had 29,866 positive COVID cases. So it's important to recognize that getting the vaccine, it's not just about survival, it's not just about preventing severe infection, although that's very, very important, but it's also kind of about preventing spread of the virus. So the concept herd immunity is kind of thrown around a lot. What herd immunity means is that when about 60 to 70% of the population is immunized, that helps to prevent the spread by limiting the transmission abilities or exposures. And so that's one way that we can kind of hope to protect loved ones or community is by providing that little protection or barrier from transmission. So, and I just wanted to share that statistic about, and also kind of explain the concept of a little bit the concept of herd immunity. So what are the common side effects after getting a COVID vaccine? And we kind of covered these a little bit earlier, but some of the common ones are pain, redness, swelling in the arm, can have tiredness, headache, muscle pain, chills, fever, nausea. And how long does protection from the COVID virus last? So at this point, we don't know 100% of how long it will last. So those are some of the research studies that are being continued and done. What we do know is that COVID-19 has caused severe illness and death, and so having some protection hopefully will help reduce our mortality rates. And then, do you still need to wear a mask and avoid close contact with others after getting the second dose? And at this point, yes, because the vaccine is available in limited quantities. We don't necessarily know everyone who may choose or not choose to get the vaccination. So at this point, The CDC has though released some guidelines saying that for those that knowingly or fully vaccinated, they can get together indoors without physical distancing or wearing masks. So if I've already had COVID, do I still need to get vaccinated? And experts still are recommending yes, get vaccinated because it may provide that extra immunity that maybe the natural immunity doesn't and may cover against the variants. So, and last question, how many doses of COVID vaccine will I need to get? And of the 3 that we talked about, the two doses are needed for the Pfizer BioNTech, and those are 21 days apart. 2 for the Moderna, those are 1 month apart, and then the Johnson & Johnson is 1 dose. So, and then I just wanted to share personally my experience with I did get the Moderna through the tribe, which thank you very much. I initially had arm soreness, pretty sore. I was like, wow, this is pretty sore. And then the second dose, I was like, wow, this hit me a little harder. I had the arm soreness. I got the first one on the left, the second one on the right. I developed headache, kind of just all over, joint pain, felt very tired, and just really felt that my body was fighting something, and that's really that immune system mounting. And then for the second dose, I did take some Tylenol, and that seemed to resolve. And then by day 2, I was returned to normal. So, and that's the end of my presentation.
Great. Thank you, Maria. As Maria has also told us that, along the healthcare workers here at the clinics and employees of the tribe, we did receive the vaccine. And I can kind of pretty much echo Maria's sentiments as far as how she felt. The first time I had a mild fever and my arm hurt, kind of like getting a tetanus shot. And the second one, I had a lot of fatigue, a fever, and my arm hurt again. But on the second, third day, I was up and going again. The CHWs have been making follow-up calls on all of our patients who receive the vaccinations. And what we're finding is a lot of our elders are having hardly any issues whatsoever after the first and second dose. So, and we also did open up our vaccine clinic to where it's 18 years and older now. So it's not just for elders anymore. Almost kind of like tricks. They're not just for kids anymore. Isn't that a commercial?
Yes.
Okay, so we do have a few questions. One question Maria did answer is, can we take the mask off after the second dose? The CDC, like Maria said, is stating that as long as everybody has been vaccinated, has had both doses, you can take your mask off and not social distance. But you have to be 100% positive that everybody in that circle has been vaccinated. So to be on the safe side, I would recommend still wearing the mask. That's just me though. You can make up your own mind on that one. So we have 2 other questions. Will we need to get a booster shot after you have received both doses? Will we need a booster shot next year? Do we have that answer yet?
So we do not. We do not have complete answer as far as that is. There is some researchers that are predicting that the virus doesn't show as much variance capabilities as the flu. So while they are considering a booster as the variants develop, at this point, we're not seeing as much variability as we've seen in the flu. So could it be possible that maybe we are covered with one booster? It's possible. So that's kind of where the research is at right now. And hopefully, we'll know more as the year continues and more people are vaccinated.
Okay, we've answered everybody's questions. You can go ahead, if you do have any other questions after our Facebook Live has ended, please feel free to leave them in the comments, as we will check them periodically over the next week. And I would like to once again thank Maria for joining us and talking to everybody about the vaccines. And hopefully we've kind of put to rest any fears or concerns that you have had. And if you haven't had the vaccine, definitely give us a call and we will get you in to get the shot. We just got a question. Which brand of shots are you giving? We have Moderna. It's 2 doses a month apart. And okay, that's it for questions. Once again, we would like to thank you for joining us. Don't forget, every second Wednesday, we have Wellness Wednesdays with the CHWs and the behavioral health. And that coming up for April is going to be talking about the quote-unquote baby blues, postpartum depression, and anxiety and everything that goes along with it. And once again, thank you. Have a great day, and we'll see you soon.
Thank you, everybody.